Good morning, dear students. Last class we discussed about the drug dependency, different types, and their treatment options for this alcohol withdrawals. Okay, next we discussed about the drug abuse. What is drug abuse? Actually, this drug abuse and addictions, both this grouped as substance or drug, this called as use of drug use disorders. Mainly is an inappropriate or usually excessive self-administration of a drug for non-medical purpose. That is the drug abuse. This may be include tolerance to withdrawal form of the substance. Okay, these are some major drugs of abuse: nicotine, marijuana, CNS stimulants like cocaine, amphetamine, and their derivatives. Okay, these are some important drug abuses like this: nicotine, marijuana, cocaine, amphetamine. So mainly this nicotine is used for this smoking. Nicotine and marijuana is using as a smoking. Main mechanism of this nicotine, this mimic actions of the acetylcholine, and this mainly stimulate the depressant action on CNS and CVS. This tolerance develops rapidly and is a strong psychological dependence. This is a best example of strong psychological dependence. Withdrawal symptoms indicates of physical dependence. Yes, marijuana, this category mainly interacts with G protein coupled cannabinoid receptors and among other actions. This mainly shows the pharmacological effects like euphoria, uncontrollable laughter, loss of sense of time, sleepiness, loss of concentrations. And in case of tolerance and dependence, this mainly produce some tolerance, very mild physical dependence. Okay, in case of cocaine, amphetamine, this usually used as oral IV. This cocaine mainly binds the dopamine reuptake transporter, and this amphetamine increase the release of neuronal catecholamines. These drugs mainly produce the pharmacological effects like euphoria, excitation, increased alertness, and its tolerance and dependence. Usually these cocaine categories produce the rapid development of tolerance, and withdrawal symptoms are usually this increased appetite, depression. And any therapeutic use of these categories of drugs: nicotine, there is no therapeutic use. Marijuana, this mainly this category, cannabinoid category, this dronabinol, this mainly used as nausea and vomiting of cancer, for cancer chemotherapy case, and appetite stimulants. So this marijuana, this cannabinoid category, so this also have a therapeutic use. This cocaine and amphetamine is also have a therapeutic uses, like this cocaine is a local anesthetics. When other drugs like this amphetamine is also used, mainly this is used in narcolepsy. Okay, what are the adverse reactions of these drugs? Nicotine mainly showing this cancer, obstructive lung disease, cardiovascular diseases. Marijuana, main adverse reactions are bronchitis, increased pulse rate, readiness of conjunctiva. And in case of cocaine and amphetamine, this mainly produce the paranoid cystophilia, amphetamine specific nitrizing, arthritis, hypertension, stroke. These are some things that are what are the treatment options for this nicotine abuse. Usually this nicotine gum, transdermal patches, lozenges, all these forms are available. And in marijuana, these treatment options are behavior modifications. And in case of cocaine and amphetamine, usually antipsychotics or antidepressant categories of drugs are mostly preferred. Okay. Next we come to the pharmacotherapy for the treatment of tobacco dependence. For tobacco dependence, usually this is the first line therapy with bupropion and varenicline, and for second line medication nortriptyline and clonidine. This bupropion, this drug is mainly antidepressant category, and this is found to be effective as a smoking cessation. Usually the sustained release formulations are used, and is taken as twice daily. Its mode of action in smoking cessation is not completely understood, but this dopamine and norepinephrine reuptake inhibition together with weak nicotinic antagonistic activity. This also contribute to the repeated reduction in the severity of nicotine cravings and withdrawal symptoms. It is usually helpful for reducing the severity of nicotine cravings and withdrawal symptoms. This another drug, this varenicline, this drug is also used as a first line. This drug is mainly launched in 2006. Is the first new prescription drug for smoking cessation for around 10 years. Is a partial agonist activity in nicotinic receptors, and this have the mainly blocking these receptors, and thus helpful for preventing the nicotine from reaching them. That's the antagonistic action. These effects usually helpful to provide the relief from the withdrawal symptoms experienced by smokers. The second line medication, that's the nortriptyline, is a second generation tricyclic antidepressant. Is mainly used in treatment of major depressions. It is used as a second line agent in smoking cessation. Some of these studies shows that is the therapeutic effect on tobacco dependence. In addition to its antidepressant action, its noradrenergic effects replacing those of nicotine and its nicotine receptor antagonistic activity. But there are no preclinical or clinical studies available to support any of this potential mechanism. As a typical antidepressant, this nortriptyline produce some of these adverse effects like sedation, dizziness, insomnia, blurred vision, constipation, nausea. But these adverse reactions are occur only in patients being treated for depression. These adverse reactions are less common at the dose when this dose is used for smoking cessation. Okay, this nortriptyline and bupropion, these drugs are mainly known as the black box warning list because this increase the risk of suicidal ideation and behavior among children and adolescents taking antidepressants. And some precautions, this caution should be used when this considering this nortriptyline for serious disorders because this mainly increase the risk of dysthymia, hypertension, tachycardia. This clonidine is another drug. This most commonly used for this hypertension. This also helpful in effective in reducing the symptoms of nicotine withdrawals. This clonidine has the central effects, the sedation, anxiolytic. Systemic effects are hypertension, bradycardia, dry mouth. This clonidine efficacy for smoking cessation is based on its ability to counteract CNS features of nicotine withdrawals like this craving, anxiety. So, specific dose regimens for tobacco sections have not been established. Mostly it is available as this tablets, transdermal patches. Okay, most common adverse events with bupropion is the insomnia. Only 30 to 40% of patients are reported, and dry mouth only 10% is reported, and seizures are reported 1 per 1000 persons. So most common adverse effects with the varenicline is nausea, only about 30% of patients. Insomnia, GI upsets and headaches are other most notable adverse reactions. Next we come to this the pharmacological management of alcohol abuse. For usually this alcohol dependence class, we discussed about some of these drugs. This alcohol dependent drugs is also useful in case of this alcohol abuse cases also. What are the drugs? This the disulfam and this naltrexone, acamprost. These drugs are also we can used in case of drug dependency also. So this in drug abuse mainly these three drugs are mainly used. This disulfam, this mechanism we already discussed. This mainly inhibits the aldehyde dehydrogenase enzyme, so this increase the accumulation of acetaldehyde in blood level. So this exposure to alcohol in this presence of these drugs causes the manifestations like flushing, headache, palpitations, nausea, vomiting, decreased blood pressure. So these adverse reactions can discourage the impulsive alcohol consumption. Naltrexone, this the opioid antagonist, this blocking the opioid receptors and this decrease the alcohol cravings and is most effective in those with a genetic predisposition to alcohol dependence, but its use is limited by potential liver toxicity. A depot preparations of these are available. Another drug is acamprose. This mainly modulates the glutamine neurotransmissions by acting at the central metabolic glutamine receptors. So this drug is generally well tolerated, but its effectiveness remains equal. It can be combined with naltrexone also. Next we come to the some newer approaches for these addictions and abuses. What are the newer treatment options we can select for this one? Usually these therapeutic vaccines are the promising approach to tackle the problems of drug abuse and addictions. So most of these drug addictions are with cocaine, nicotine, fentanyl, heroin, oxycodone. These are the some drugs this showing. So therapeutic vaccines are the newer approaches for these drug addictions vaccines. How these drug addiction vaccines are work out? Usually these drug addictions vaccines, when you are acts on this um, usually when this drug abuses, when this crosses the blood brain barrier and this acts to the brain and show these effects. So we can prevent the drugs from passing through the blood brain barrier. So it will help to prevent it from showing its addictive and psychoactive effects. So these vaccines mainly blocking to entering the drugs to blood brain barrier. Okay, so this helpful to prevent the addiction effects. So these vaccines mainly acts by causing genetic mutation of aldehyde dehydrogenase enzyme, which is the most second most important enzymes in alcohol metabolism. So this leads to accumulation of acetaldehyde, which is not metabolized due to the lack of enzymes involved. So this leads to the feeling of uneasiness like this nausea, flushing, increased heart rate. So which leads to the aversion for this alcohols in addict. So this therapeutic vaccines is once this injection will have its effects for 3 months. Most of these animal studies have shown promising results and clinical trials are currently being planned. Nicotine addiction vaccines. These vaccines are mainly say newer approach. That's the NICVAX. These are mainly developed in biopharmaceuticals. Okay, nicotine vaccine is mainly used for this treatment of tobacco dependence and is a novel development by this pharmaceutical industries. So what are the advantages over this existing smoking cessation therapies? This vaccine showing the irreversible effects on the immune system for 6 to 12 months following vaccinations. And these results mainly showing this the if this administrated this showing the generation of high anti nicotine antibody levels in patients those is vaccinated with this Nigvax. So this helpful to give the ability of the patient to stop smoking. Main advantages, that is the irreversible effects on the immune system for 6 to 12 months following vaccination. Disadvantages, the necessity for multiple injections. Okay, and some other options are also for this nicotine addictions, like this MO inhibitors, that is selegiline, is the ability to reduce the dopamine metabolism. So it has been investigated as the potential therapy for smoking cessation. Some of this National Institute of Drug Abuse, this based on their report, this selegiline mainly decrease the effective in reducing the withdrawal symptoms of nicotine addictions, and this currently on the phase 2 trial. This selegiline is available for smoking cessation as an oral transdermal formulation, but is on under investigations. Another drug is the cannabinoid receptor antagonist is also on the trial. This rimonabant is a primarily this drug is used for anti-obese drug. Is also useful in case of smoking cessation treatment, but some of this increased risk of side effects like this depression, suicidal effects. So in FDA in 2007, because of this safety profile, the manufacturers withdraw this new drug approach to FDA. Okay, so when you come to this the assignment section, what is the pharmacological basis for using benzodiazepines to manage alcohol withdrawal, and write down the pharmacological treatment of alcohol and nicotine addiction. All these sections we already discussed. Okay, thank you. And this June 26 is recently we are this the International Day of Against Drug Abuse and LC, that's the 2021. This recently this day is mentioned. And what are the importance of this day? If you have studied all these drugs abuse symptoms, so necessary to give the awareness to the society. So for every year June 26 is celebrate or this the as the against this drug abuse day. In 2021, this the main theme is the share facts on drugs and save lives. So we have the what are some commitment to the society to give the awareness about to avoiding these drug addictions and alcohol addictions. Okay, thank you.